Hi, I'm Justin, Dr. Walters. I'm interviewing for your associate position. Right now I'm going to answer the questions that you had laid out for me to do during this video interview. Define chiropractic. I would define chiropractic as the treatment of disease, the diagnosis and treatment of disease in relation to the neuromusculoskeletal system. That would be probably the broadest definition that I would use for chiropractic. You want me to tell you more about myself? Well, I am a 27-year-old male. I grew up playing, a normal child, playing, all sorts of sports in high school. I played baseball, football. In junior high, I played track and basketball. I went off to college at K-State. At first, I was wanting to be a business major. Before you can be a business major, you have to take the prerequisites and then apply to get into business school. So while I was taking my general education classes, I, took a course called conceptual physics, and I kind of fell in love with physics, and so I fell in love with the natural sciences. Took biology and chemistry the next semester, and after I took biology, I kind of knew that was the field I wanted to go into. Well, I decided that my major would be microbiology. There was only two major programs at K-State, and it was biology or microbiology. So I decided for the latter, and just because I like the microscopic aspect of biology more than like the ecological aspect, so I decided to focus it as much as I could. Well, deciding on what to do after I graduated from college seemed like an appropriate thing to do, junior, senior year. So I, was like, well, what am I going to do? And I started looking into healthcare fields, and looked into going to medical school. I saw, there was all sorts of, things that you would have to do, and it was pretty competitive, and so, I kind of put that kind of on the side. I was still considering it, but kind of put that on the side. Same thing with going to vet school. I considered that, knew it was pretty competitive. But as I was kind of hashing these things out with my dad suggested that I, talk to his chiropractor. And, he kind of told me why he wanted me to go see his chiropractor. Well, apparently he was having back issues when I was young. I didn't know necessarily what was going on. I remember stepping on his back to pop his back, but not something a chiropractor would suggest. But I didn't know it was as severe as it was. I guess he was scheduled for surgery, and before going into surgery, he asked his surgeon the day before his back surgery, what are the chances that he'll recover, or he won't have the pain anymore. And the doctor kind of gave him a 50-50, and so he was he was a little concerned with this, and so he ended up seeing a local chiropractor, and the local chiropractor ended up saving him from having to go through back surgery. So my dad definitely had a passion for chiropractic before I even even knew it. So, anyways, I went and talked to his chiropractor, shadowed him, and you know, I fell in love with the whole health concept, the whole, you know, staying healthy, you know, preventing disease as opposed to, you know, getting disease and then, you know, curing it. Anyways, I like the proactive approach, and I, you know, kind of live by that. So, what are my long range objectives for my career? For the most part, I'd like to get some postdoctoral education, and so I don't know. I've always been a sports fan and kind of marvel at performance athletes. So what I would like to do is, in the future at least, pursue my certificate in sports chiropractic, and then eventually go on to the diplomat program. Where do I see myself in 5 years from now? I see myself in a successful practice, helping many patients who I would love to see, you know, appreciate what I've done for them. Hopefully in that 5 years I will be at least pursuing the sports chiropractic certificate. What are my strengths? I would say my strengths are, I'm kind of a go-getter. I like to, you know, pursue my interests, and with everything I have, I usually don't leave anything on the table at my discretion. You know, no tool will I leave behind when I go to try to accomplish something. Strengths, I'm also a very personable person. I enjoy getting out and talking to people about chiropractic. I enjoy really sharing any conversation with almost anybody. I don't know, sometimes I find myself, this is a weakness, sometimes I find myself, you know, kind of talking just to be talking, you know, and I enjoy it, but sometimes I'll get off subject, or, you know, end up just talking to be talking. Another strength I would say I have is I'm a really focused person. I guess that can go into the driven part, but you know, once I get onto a subject, I dive deep into it. So I'm a pretty astute learner. So other weaknesses that I have. I might have to come back to that. Always focusing on your weaknesses are kind of tough. Anyways, the motivation. I'm motivated by many things. You know, one is personal pride, which, you know, kind of a two-edged sword. But also pride for my family and friends. Like I want them to be proud that, you know, that they know me, and so, you know, that's one motivating factor, is, you know, that they see I succeed. But the main motivating factor is that I'm performing God's will. I was born and raised Catholic, and I truly believe that God exists, and so I want to do everything within my power to, you know, fulfill God's will. And if God's will for me is to be a chiropractor, I would like to help and obviously